I'd like to talk to you today about a new Medicare benefit to help patients and their families have discussion about treatment options and advance directives. There are three major documents I'd like to discuss today. One that says who you want to speak for you if there is a time you can't speak for yourself. Another that describes your preferences for treatment. And the third is to identify who you want to have access to your medical condition. Later, the facility's educational coordinator will come by to answer any questions you might have and to help you complete these important documents. But first, here is Stan Craig with ForeTalk to talk about why we are so passionate about having these conversations.
Hi, I'm Stan Craig, and I want to take just a couple of minutes to tell you why I'm so passionate about advanced care planning. The reason is pretty simple. When it becomes personal, then you own it. The day after Thanksgiving, my brother was very ill, and we took him to the emergency room at the hospital. As he was rolled away, he turned to me and said, "I'm so glad you're here." That was the last time he said, "I'm so glad you're here," because it was 41 days of a very uncomfortable period for both of us. And the reason is, when the doctor came back, he said, "Ron's going to be having intensive treatments, very aggressive treatments. That means he'll be in intensive care, he'll have radiation, he's going to be in coronary care, he's going to have a difficult time. So, do you have his living will?" I didn't know what a living will was. I'd heard about it, but not practically. It wasn't personal. Then he said he's going to be unconscious sometimes. He'll be incapacitated because of his treatment. So do you have his durable power of attorney for health care? That's strike two. That's the second thing I didn't know what he was talking about. The next day, an attorney came. Ron had been in an automobile accident. He said, "So I understand Ron's really ill. Does he have a will?" Didn't know. "Are you his executor if he has a will?" Didn't know. "Well, who's going to represent Ron in court? Who's going to sign his checks? Who's going to take care of the fiscal things that he has to do while he's hospitalized?" I don't know. As a result of my ignorance and our lack of discussion about this topic, Ron was in the hospital for 41 days and then passed away. While he was in the hospital, he had 7 doctors. He had every kind of treatment that you could have, and many of those treatments were designed to provide a recovery. The truth is, Ron had stage 4 lung cancer. I wish I'd been smarter, because what I would have said to the doctor is this treatment going to be a bridge to healing, or is it just going to prolong his death? The truth is, the doctor would have said to me, truthfully, there is no healing for stage 4 lung cancer. Had I asked that question, I would have taken Ron home. He would have gone fishing. He would have been spending time with his children, his grandchildren. He could have eaten anything he wanted to, been surrounded by the people he chose, rather than being in intensive care, rather than cardiac care, rather than having tubes and machines and people around him 24 hours a day that he didn't know, asking him questions that he didn't even want to answer. That's why I'm passionate about advanced care planning, because if my brother and I had done that, we would have had not only a much better time during that period when his life was coming to an end, but he would have passed away at home, surrounded by family and friends for the most part, not lonely in an empty room, surrounded by people he didn't know. I hope that you'll take this seriously, and that you'll understand the purpose of a living will, of a durable power of attorney for health care, of why you need to have a will, why you need to have a durable power of attorney for finance. And remember, I used the word durable a couple of times. The reason is it endures even when you do not. That means when you're incapacitated, someone can speak for you, someone you trust. That's why we're committed to advanced care planning, and I hope you discover the value of it not too late